It had been 20 years since I saw a cardiologist, and I just thought I was just fine. My wife Beverly kept suggesting that, hey, look, you just need a checkup. I just happened to be talking to Dr. Nair one day. I said, hey, Beverly kind of wants me to get a checkup. And so immediately she jumped all over it, and we did a 30-day Holter monitor, we did an echo, and we did a calcium scan. And that's where the alarm came. The calcium score was higher than it needed to be, and she immediately said, hey, look, we need to go and check it out. We need to do a heart cath on you. I had some blockage in the widowmaker. One was an 80%, one was 75, and the other was 50 to 60. So I feel very fortunate that I didn't have a heart attack or I didn't have a stroke.
I had sudden cardiac arrest. I got up as usual, went to the gym and walked, and went back home, got ready, went to work. I only remember so far that I had went down the hallway, and when I came back down the hallway, I kind of just leaned up against the wall and just kind of collapsed there. My student workers started CPR on me, and then campus police got there and took over for her, and I get emotional. They had to shock me several times and then got me to St. Bernard's.
Heart disease continues to be the #1 killer of citizens in our community. Before deciding to go into medicine, I was on a track to become an engineer. And when I realized that surgeons are really like engineers for the human body, it just was a natural connection, and I decided to go into heart surgery. One of the most important aspects of the St. Bernard's cardiovascular program, and one of the things that really sets it apart from other programs, is that we have extremely strong clinicians, we have extremely strong administrators, and we have a real strong interest in leveraging innovation and technology to our patients' benefit. And that's not something that you see at all centers.
We're always looking for the next thing. What is the next thing that we need to offer to the community to make this program better, to help our patients better? And we all try to keep the bar high for each other. We look at each other's procedures. We know that everybody's reading the latest journals, and we talk about it every day. Fixing a problem in the heart is very risky. We have this mechanical cardiovascular support, and we can leave that in there. It's almost like an artificial heart that you can leave there for just a few weeks until that heart has recovered, and that has made a big difference in our post-operative recovery in a lot of our patients.
I had no blockage, and then I went upstairs to their ICU. I know that I was on a heart machine that pumped my heart for me, and I was also intubated and all. I remember some right shortly after that. You can't beat the ICU up there.
We're moving patients through the ICU a lot quicker. We're trying to decrease our time to extubation, getting patients home a lot faster. We have the Impella device that we're using now. We use quite frequently here. Patients with low ejection fraction that normally would not have been surgical candidates in the past. Now we can do these cases with a lot of confidence that patients are going to do well.
Growing up, I always thought I wanted to be a doctor, and I really thought I wanted to be a cardiac surgeon. Things changed in my life as I was in med school. My dad had cardiac arrest, and he passed away suddenly. And that is what got me into the field of cardiac electrophysiology. Because cardiac electrophysiology is the specialty in cardiology that focuses specifically on the rhythms of the heart. And cardiac arrest happens because of electrical abnormalities in the heart and abnormal cardiac rhythms. And that is what got me in the pursuit of what can change in the field of cardiac electrophysiology. And that is what drives me every day. What we bring to St. Bernard's with all our cutting-edge technologies, a lot of patients, a lot of families don't have to go through what I went through.
Going back long ago, we started working on something called door-to-balloon time. This is when you have a heart attack, how fast do we inflate the balloon? In other words, how fast do we open that artery for you? We've educated the ERs and other facilities. We work with the EMS crews so that they alert us ahead of time. We have our own staff able to be here in very short order. We've sped up this door-to-balloon time amazingly in the last 10, 20 years.
ASU installed AEDs on campus, and we have 2 in our building. And as soon as, it wasn't long after I had went down that they got the AED and got it going. I'm glad it was there because it definitely makes a difference.
It reminds you that we've been working on this system for so long. We've been working with first responders, placing AEDs all over the city. So when something like this happens, it reminds you all these years that we've been doing this for, it really is making a difference. Sometimes there could be more than one way to fix a problem. We go to an interdisciplinary conference. We have the 2 heart surgeons. We have several cardiologists, some non-invasive, some interventional. We're going to look at the problem in different ways, and then we're all going to chip in.
Being able to sit in one room with your colleagues and collectively come up with the best treatment plan, I think that's very, very important.
It's a model that we call shared care, and it allows us to all get together to discuss what's in the best interest for the patient, what's the best approach for the patient, how to use all of our various clinical talents to the patient's best outcome.
When I think about what St. Bernard's offers in the heart care program, I can't stress enough how large a group of diverse specialties we brought together for this cardiovascular program. We have somebody who is a specialist, sometimes a world-renowned specialist in every aspect of cardiovascular care. Coming here gets you that. I'm pretty proud of that.
I think I'm extremely lucky that we caught it. They're fixing it. The level of professionalism, their ability to communicate with you and put you at ease. Just the personal care, if they only knew what they do, makes a patient so comfortable that I get a little emotional here, but very blessed.
I only had 1 child, but I want to be here to see hers. That's probably why I am here. We're looking at retirement, and my husband would like to spend it up in the hills, but I'm like, no, that's too far from my doctors. I'll come visit.
About 12 years ago, I remember seeing a kid that was in the ICU, was at the moment of having a cardiac arrest. And I remember walking into the ICU and seeing the sheer terror on the parents' face and on the family's face. And I remember myself when I got the call about my dad and how he had the cardiac arrest. And to me, that was one of those moments when I was able to hold their hand and say, I got this. And taking the little kid back to the operating room and being able to cure him, not even just fix him, but cure him, and be able to now see him as a dad and enjoying his life with his family and with his little baby, and seeing the sheer comfort in his parents and his family's face every time I see them. Those are the moments that change you as a physician.
I now know these people super well. My parents live 40 miles away. I see my old biology teacher. I see all sorts of folks that I've known way back. And, I get to take care of them at the end of their lives. I get to extend their lives if all goes well.
Something that I'm actually quite proud of at our hospital is the mission of the hospital, where we are helping people that no matter what. I like to be able to help a person just because that's what we do here.
This is probably the most important way to give back to the community, is to help us maintain the health of our community.
As a group of physicians within the heart and vascular, we've always committed to delivering the most innovative technologies, the most innovative treatments to our community. And that just is not possible without the dollars.
The donation is an investment to the community, not necessarily just the hospital or the heart program, but Northeast Arkansas, our community.
When I think about what we can do with donations at St. Bernard's, you think a little bit about the sisters' mission here, right? The very fact that no one is turned away from St. Bernard's, I think makes it obvious that your donation's going to a right place.